Okay, so thank you so much for joining us. This is Dr. Mohammed Ali, Afshan Mohamedali. She's a licensed clinical psychologist practicing in New York. She currently works in clinical practice and is also teaching at the doctoral level at Adelphi University to trainees. And she currently provides psychotherapy services primarily to adults within either an individual or couples domain. And with that, thank you so much for joining us today. So we're just really going to try to gauge your experiences during the COVID-19 pandemic within psychotherapy, and we'll ask you some questions related to that. But before we go on to that, we wanted to know what are primarily the patient population like that you work with, and then after that, what was your experience like overall in providing psychotherapy services during the pandemic?
Yeah, great question. So the populations I work with before and during, and I guess after the height of the pandemic has been adults primarily. Adults in either, like you mentioned, individual couples therapy. They presented therapy with struggles, issues relating to depression, mood, anxiety. We do a lot of focus on relationships and identity, life transitions overall. So given the nature of the pandemic, that kind of very well lent to what patients were going to be experiencing in a heightened way. I think, just like everybody else in March 2020, everybody was going through the same adjustments. So it was very much a parallel process. Therapists, patients alike were adjusting to a very high level of uncertainty and unknown. So in reality, I can recall my last day in the office and then making that decision to start seeing patients online, thinking that it was going to be very temporary. And obviously we know now that it wasn't. My patients were very much on board. I think that they recognized a need for some kind of constancy in everything, like I said, that was so unknown. And so they were very ready, willing, and able to transition to a telehealth way of doing our work. So everybody transitioned more or less. And we just kind of went from there, seeing each other week by week, processing what was coming up. I think I found myself disclosing a little bit more too than I normally would, simply because it was so obvious we were all going through this at the same time. It wouldn't have felt real or authentic if I hadn't. And then over time, I think everybody kind of either found a groove in terms of working with me and figuring out what was going to, what the space was going to be and how they were going to use it. And so I would say, like, it's been 2 years now of working in a very telehealth way, and it's been eye-opening to see that it actually, it can work. I think I know I hadn't had that experience before as a telehealth therapist, and probably had my own biases against it, but there is something pretty powerful in it that I think we can tap into going forward.
Yeah. Thank you. Sounds like it was a bit of an intense period of transition.
Yeah, certainly was. Like I said, I had expected, I think everybody expected, and maybe even hoped that it would be very temporary. And once we kind of realized it wasn't, and even as the world is kind of shifting again more recently, we can kind of see that this platform, this way of doing the work is here to stay. And so it does require, I think, an approach, thinking about it differently in a way that we can make use of it. So certainly.
Thank you.
So one thing we came across in reading about this topic is certain patients forming routines that they weren't previously engaged in, that became a really pivotal part of their life and or identity during the pandemic. Would you be able to speak to any experiences of that and how that maybe came up in practice or was something that was discussed in sessions?
Yeah, it's a great question. I think as humans, and I can say this about myself too, I'm sure maybe you guys can reflect on it, is we like our routines. There's comfort in there. There's some kind of solace in having something to rely on, depend on, predict. anticipate. It's what we love, in terms of managing anxiety, especially control what we can so that the things that we can't become a little bit more manageable. And so quickly, so much of that routine was taken away. So I think, again, given that we as humans love that and need that, we were looking for it again. It was going to be different. I think what we had to do, and I can say this about patients I've worked with, there was a process of recognizing the loss of some of those routines, really processing that, mourning that even, and then coming to a place of acceptance so that a new routine could form. And that has looked different for everybody, given what our lives have looked like. But certainly in the way that the routines would offer us structure. I found myself encouraging patients to find another way of structuring their time, their lives, boundaries, given that everybody was kind of in very close quarters. So there was certainly a renewed routine, or a need for routine at least, that's looked different. And then over time, it's been practiced now. So it kind of is the new routine. And as things are shifting, like I was saying before, in a way, that routine now is changing again. Like, how much of that routine do we want to maintain? How much of that are we ready to let go of? Are we going to return to an old routine, a new one altogether? Some kind of combination of the two.
Just like, I had a follow-up question on that. Like, has there been a little bit like of difficulty like in kind of making that transition now that like we're kind of in this unknown period of like, is the pandemic kind of coming to an end, like the restrictions are loosening, like how has that kind of been?
Yeah, I've been thinking about a few people that I've worked with that are struggling in this area, and not, I won't get into specifics, but there is something, I think, for example, that we've found a lot of light, maybe even in hope, in being able to have a little bit more agency in our own time. And so going back to work, for example, means giving that up just naturally in the way that commutes are. And what we used to be able to do just in the last couple of years, we really either have to find a new way to do it or do without it for a little while as we're adjusting. So I would say, yeah, it's maybe equally difficult, just as it was a couple of years ago.
And do you think that this is going to change the way that you practice long term, and basically adapting all these different strategies to have psychotherapy services? Will you continue with that? In what ways do you think that's been advantageous?
Yeah, I smile because it's something that I have thought a lot about. I think we could all say that we've changed personally and professionally in the last couple of years, and we've all had to really sit with what we do, why we do it, how we want to do it. As I mentioned before, I never had experience as a telehealth therapist. This certainly launched us into that. And it's really hard for me to imagine a future that doesn't exist. So I think in the long term, I do see myself maintaining some telehealth practice. I very much enjoy in-person work, so maybe it'll look like a hybrid in the near future. But certainly, I think this is going to be a part of my practice, and for a lot of reasons. In addition to simple like convenience for myself, but also for patients, I've been able to work with patients I never would have met before, so all over the state, and offer my unique service, whether that's my own background, my own style, just kind of the way that I work, to people that, like I said, I never would have met before. So it's really hard to return to only in-person work, knowing that that's not going to be an option anymore. There's that. There are just the other ways, reaching people who typically couldn't make it to regular session because of either transportation issues, childcare issues, simple just like changes in scheduling. So being able to maintain some kind of telehealth service allows for so much more flexibility in that way, meeting patients where they're at and doing work that we feel good about. In terms of the actual work, I do think it requires a little extra effort to communicate all the things that we want in a therapeutic relationship when it comes to trust and authenticity and warmth. There is a need, I think, to overcome the screen. And that in itself is a skill that I think we're learning by doing. So certainly something that has changed me and probably will continue to evolve.
Thank you.
So another question, a little bit similar, is about people undergoing more significant personality changes than we typically expect of adults, over 25. In the pandemic, often people becoming maybe more introverted, and anything would fall in this category. And maybe you could speak to what it was like to potentially see some of those personality changes and how it was like to work with those patients.
Yeah. Obviously personality changes over time, and this is certainly something that has been going on for a little while now. So we're seeing the beginning of those shifts, some things being solidified in personality. And not that that's, I wouldn't say that it's a good thing or a bad thing, it's just change. I think it's important to understand why and where that change is coming from. My thoughts are, if we think of the pandemic like a trauma, like any kind of stressor, it's going to exacerbate a place or distress that the patient had already been predisposed to. So if somebody, for example, has always taken refuge in isolation, that it actually helped with limiting their anxiety, even if it exacerbated their depression, the isolation and quarantine that the pandemic necessitated would push them in that direction even further. So they'll find even more comfort in that and even have an excuse for it. So it's really hard to, I think, shake that. And again, is it our job to shake that? Because this is kind of what the world has looked like. More importantly, I think, is helping patients understand, like I said, the motivation as to where that's coming from. And does it have to be that way? How much of what they're experiencing is real valid anxiety about the way the world is? And how much is it, like I was saying before, more reasoning to fall, into their defense even further?
Great. And one more thing, we sort of addressed this, but it's a tough question because it's a question about, I guess, trade-offs, is in terms of disadvantaged groups. Do you think that the shift to telehealth, or I guess the option of telehealth, is primarily an advantage or a disadvantage to said disadvantaged groups? And obviously there are factors that lean in both directions.
Yeah, I have a hard time with primarily. I'm not sure if I can say one or the other, but clearly there's both. Like one is that, like I was saying, yeah, we did touch on it, that it has helped alleviate some issues of transportation and scheduling, childcare, even just kind of like the dependability of getting to session. But, and I saw this when I was working at a community clinic, while some of those issues had been alleviated, it brought on a whole new set of issues: access to technology, stable Wi-Fi, even just like a general knowledge of setting up a telehealth appointment. Like so much of that had, I think, set in as an obstacle to treatment, which in itself had to be addressed first before doing the work. I think also, and this is something I often speak about too, even with my patients, is I was so accustomed to providing a safe space for patients. Like, this is the office, this is where we come to, this is a calming, neutral space. And for a lot of people, especially given what they're going through, the sources of their distress, we are now placing the responsibility on them to create that space for themselves to do this work. And I can't say that that's always possible, even week to week. Like, I can't tell you how many sessions I've had with patients who are sitting in their cars because it's the only place that they can really do some of this work and let themselves feel. Or how many sessions I've had with a patient who has their headphones in because their child is sitting on the couch watching TV, and they need to kind of be with them, keep an eye on them, but of course also do this really important work. So those are new issues that we didn't really come across, at least not as directly before a couple of years ago.
Yeah, it sounds like in terms of the downsides, that some people may have been, robbed, to use an extreme word, of that like special space where there weren't really distractions, and the therapist's office, that now it's like there's more to juggle, and it isn't that like unique part of their routine to remove themselves from their lives.
Right. There, that in itself, as we're talking about routines, like that in itself was a routine,
Right.
leaving work in the middle of your day or ending your day and, walking over to your therapist's office, whatever that process was like, was more than just those 45, 50 minutes, right? It was a whole routine or set of behavior, set of actions that I think induced a very positive feeling, or at least a sense of doing something for yourself. And now I think, especially where we are in the way that we structure our time, is so often I can feel it. I can feel that appointments with my patients are just squeezed in between meetings, simply because all I have to do is log off and log on. And that doesn't really afford anybody, I think, the time we need to kind of really sit with the stuff that we're doing.
Yeah, it sounds like a lot of the work has also been placed on like managing a distracting environment. So to have one that fosters that sort of processing. What advice do you think you would have for trainees who might encounter those situations more frequently now?
Yeah, that's for themselves doing the work, or for patients?
For them with patients.
Yeah. One is to understand what distracts you. I have to admit, at the beginning of this a couple of years ago, I didn't know how distracted I could actually be. Like, here I am looking at my computer where I usually do so much, so many other tasks. And so it really did mean literally turning off notifications and, turning off updates. Like, I don't want to see that while I'm sitting with the patient. Maximizing the screen, so all I'm doing is looking at that person. I also set up my desk in a way that feels good and inviting, as though, like, yes, I'm at work. So I think that's really important, to put yourself in the right headspace. I think also, when it comes to patients, a little bit of psychoed around what the space can be and should be. So I think it's totally within our clinical know how to inform patients that it's really important that when we're here in session, we're here, that I'm sure texts are going to be coming in, phone calls are going to be coming in, somebody's going to walk outside the hall, but let's do everything we can to stay as focused as possible. And if that's not possible, what can we do to overcome that? That first and foremost needs to happen. We need to have a safe, dependable space in order to then do our work.
That makes a lot of sense. Thank you.
I think like along these lines of some of like the disadvantages and advantages of like doing telehealth, one of the things that we were thinking about, especially in terms of like disparate access to healthcare, is what can be done both at like an individual level and an institutional level to kind of anticipate, to meet this anticipated spike in demand for mental health care. How can we kind of address some of those barriers and kind of meet this probably rising demand because of this kind of collective trauma, in a sense, of experiencing the pandemic?
Yeah, I think that's a great point. And something you said reminded me of thoughts that I've had, and I think many people have, is like, we're not just coming from the pandemic. It's not over. We're actually just going to start seeing the effects of trauma, and how it's affecting, how it has affected, of course, in the short term, but how it's going to continue to affect us in the near future, distant future, and then maybe even future generations. So there is something to say about needing to insert ourselves as clinicians now, and that would mean more psychoed in the community. Do what I was saying before, like actually reaching out to disadvantaged groups and providing services and information in a way that they can receive it. I think that's really key. So that's probably something on the institutional level. I think there are so many organizations and community clinics that are doing really great work. And so I can certainly say that that has been successful in those efforts. I think on an individual level, it's also very important to make ourselves available to having these conversations. I'm not saying that we have to see everybody that gives us a call, because we can't, but what I consider as a part of my responsibility as a clinician doing this work, especially with patients of minority backgrounds, is to really spend time with them as much as we can to explain again the process, where they can actually find help. There's so much out there, but I think the disconnect, that gap in access, comes from not knowing how to do it, what it looks like, what would be best for them. So having those conversations and making those connections, I think, help in that. For them to have called in the first place is a huge step. But then for us to be like, I'm sorry, I'm not the person for you, could be so rejecting, and kind of bring them back to square one. So kind of helping them transition to the next step is really important. I mean, that being said, I think on the other end of it, there has to be some awareness of clinician burnout. I have to say, like, I've been in that position a number of times in the last few years where, because we're put in that position, because we can, we feel like we should. And maybe that's the case, but we also have to know our own limits and take that time and be able to tap out in order to return with being able to do this again.
Yeah, that reminds me of like what you talked about, like it being kind of like a parallel process, because clinicians are going through this, in different ways, but at the same time as well. So to be like an effective resource, like there also needs to be like some degree of like self-care and self-checking in.
Yeah. And you know what, I have to say, another thing I've noticed in the last couple of years is patients are so aware of that. Like, they're so aware of that parallel process too. It's not only something they feel, it's something that they know. So that anytime I might have had to cancel on a patient, or even just plan some time off, even if it was clear I wasn't going to be going anywhere, that was very much welcomed by my patients. And they seem to be really just really kind. I think that's certainly been a highlight to take from this time.
You mentioned the sort of access to historically underserved populations with mental health services. I was wondering if there have been experiences where you might have seen that a person's intersecting like race, gender identity, or even socioeconomic status might have interacted with their experiences during COVID-19, whether that might have been something that looked like either experiencing significantly more exposure to COVID or potentially issues in discrimination and stigma. So have you had any sort of experiences surrounding that?
I'm thinking of a few moments, especially early in the pandemic, when we just didn't have a lot of information. And so I think that everybody was just going off of their own fear and anxiety, and there were so many different levels of that. And so because it wasn't common knowledge at a certain point, and we didn't really have a lot of direction, everybody felt just to be on different pages. And I think we really did see that when it came to people who decided that what was best for them was going to be very different than what was best for the next person. And so I saw that with a number of people who, for example, chose to isolate early, maybe earlier than other people, or, again, before we had very strict guidelines on it. And there was a lot of, I'd say, familial conflict in that way, especially in families and communities where what we prioritize is some kind of like harmony or like a communal understanding. And then for us to, as individual nuclear groups, to decide that what I'm going to do is very different than what you're going to do, I think it did feel very insulting. It felt very condescending to kind of put forward our own view based, again, in fear, anxiety, not in how we feel about our family, not how we feel about our community, but it was certainly experienced in that way. And so I would say within race, I think within those kinds of tight-knit groups, we saw that. I think more than anything, and I was kind of touching on this before, issues that had already been present because of race, gender, sexuality, the pandemic just highlighted it. I saw this very early on and how issues that had already existed were just stressed, highlighted, exacerbated. And so it was just such a polarizing experience in that way.
Yeah, it's really interesting that you mentioned how this played out within family dynamics and really shifting people's perspectives on what was either protective for them or protective for their community as well, and how that was perceived. Yeah, certainly an interesting take on that.
Yeah, and I think also, as you said that, it made me think of another thought that I have to admit I didn't see it firsthand, but certainly through colleagues I've heard of this, being able to isolate, even quarantine, in a way that was encouraged is a very privileged way of doing so. Not everybody has a private space in order to do that, or a separate room to be able to, you know, live, sleep, and eat. Like we made those assumptions, I think. But I wonder really how many people were truly able to do that in the way that was expected, and how many how many times did we, or how many experiences were there actually where we just did our best, and that's all that we could do.
One of the things that kind of came up for me when you were talking about that, and thinking about kind of like these intersecting identities, and some of like the stressors related to like racism, discrimination, sexism being brought about by the pandemic is, in some of the literature that we were reading, they were talking about how important, and not just in the pandemic, but relying on like religious, spiritual, and culturally based practices that person already kind of has, and incorporating that into the therapy. So I was wondering if that is something that came up for you during the pandemic when you were practicing, and if so, like what did it look like, and if you have any suggestions about how other kind of clinicians can approach incorporating that into the way that they work.
Yeah, I think that my approach to it didn't change very much, in that if patients had already an experience or relationship with religion or spirituality prior to the pandemic, or even just prior to coming to treatment, that is something I would always encourage, like, just to kind of regularly check in on that. I'm very forward, especially a lot of the patients I do work with have some kind of religious background, especially a Muslim background. So I'm very forward with, I'm not here to keep you on a scholarly path more, or anything, but if it is something that speaks to you, let's talk about that. Let's bring that in. Let's talk about why that's important to you and how it helps, what it means to detract from that, what it means to move towards that. So creating the space that they could talk about it, even if it's something that we might differ on. I will say, like, it's certainly not something that I would bring up if somebody didn't already have that experience. But my take on that, or at least my version of it, is, if anything, religion, spirituality or not, I think mindfulness has been a really important practice, especially in the last couple of years. So whether that's, full-on mindfulness exercises and, guided imagery kinds of tasks, sometimes simply just doing the emotion work of understanding the shifts in our affect, in our feeling states throughout the day, day to day, that has been really helpful. And I think a lot of time, the reason I thought of mindfulness in this part of our conversation is because it's also come up with a lot of like yoga and meditation, and that tends to be something people have really turned to in this time.
Thank you.
And just sort of, I think one final question related to this. In shifting, you had mentioned this at an earlier point about potentially like having to trust your clinician as well while you're going through this process. Given that everything has really dramatically shifted to being this sort of like telehealth mode, you're losing a lot of body language. Do you find that it has potentially been more difficult to establish trust within teletherapy compared to, let's say, an in-person modality? And how do you think that might have impacted like patient progress?
Yeah, I wouldn't say that it's more difficult. I do find though that when I'm meeting a new patient, we're starting in a different place. It's an even more impersonal place to start with. So we just have further to go versus maybe some patients who I do still work with, we might have met in the office where we had known each other for a couple of years. I think that it was a lot easier to kind of connect sooner, get to know each other a little sooner because we just had more information about ourselves. Like you mentioned, body language, the way an office is, the way a waiting room is, even just the process of intake, like all of that, I think spoke to a clinician or a patient's approach to that or approach to a new relationship. So now so much of this is just over a screen, and what you're seeing today is what most of my patients see. And there's a lot to overcome there, a lot to communicate in terms, like I mentioned before, trust and warmth and connection, what it means to be real. So again, not difficult, but just I put a lot more intent, I think, in how present I am, at least at the beginning of working with a new patient, just so that they see it, they see it, they feel it. The other thing I think is also important is to address it, because let's be real, we're seeing each other, we're meeting each other over a screen. And for so many people, I'm never going to know them in person. That doesn't make our relationship any less special, any less therapeutic. But let's talk about really what it's like to pour your heart out to somebody over Zoom. And what it means to feel a bit removed from that. And maybe if we can talk about it, we can overcome it. So I'd rather talk about it and, address it before doing really important work as early as possible.
That makes a lot of sense. Do you think that it's also been really informative to potentially have access to a person's environment in that way? That's something we haven't had when they would come into the office.
No, that's so true. I hope if there haven't already been, but many studies on that in the future, just with what patients choose to show you, either knowingly or unknowingly.
Yeah.
I've met so many pets. I've seen so many bedrooms. It is curious because some patients who might present in a certain way, and I guess I can only say this about patients I knew before the pandemic, it's kind of surprising what their spaces look like. And it certainly, just like I said, adds more to my understanding of them, but in the end, it does make sense too. It kind of makes sense with the environments that they keep and then how they present to a person. And some people are very cautious. They'll only ever show me a corner of their room and nothing else. So it's certainly giving a lot, even the spaces for the sounds that that they are currently experiencing or continuously experiencing, I should say. Like I only get to see that for maybe 45 or 50 minutes, but like that is the space they're in constantly. So that's really important to know. And you're right, we wouldn't have had access to that, but because we do, we can make meaning of it.
Right. Thank you for sharing that, and all of those experiences. Travis and Gap, do you have anything else that you might want to ask?
I had a couple more. Gab, did you have any other questions?
I'm okay on my end.
Yeah, I was just wondering also, just one of the things that kind of came up, I think, in like hearing you talk about this, and I just wanted to know if I'm kind of correct on this, like in the interpretation, is that one of the important things has been, especially for those who have been disproportionately affected by the pandemic, is fostering a sense of agency, because it can feel like there's been a lot of like control taken away just by outside factors, whether that's changed due to the pandemic or experiences of like exacerbated discrimination. Would have been like some of the steps that you've kind of taken like to foster agency, if that's been something that's been important, if that's a theme that kind of came up.
I think number one, I thought about our conversation about routines earlier. Like there is something of agency to be said in establishing a new routine. Like we choose what that looks like and why we're doing those things. There's intent behind that. I think also it requires a flexibility in thinking, and that would be something pre-pandemic as well. Like there's so much power in being able to take on different perspectives and notice when you yourself are speaking or thinking in a more rigid way, so that there is agency there too, simply choosing how to think. I think also in coming away from this pandemic, or at least trying to move forward with where we are now, there is something I think to monitor, and I can say I've felt this too personally, is a bit of nostalgia for what pre-March 2020 was like, what we used to have, what we also had during the pandemic, and now what is being up. And there's like something, there's something sweet about it, I think, that we get to appreciate. But in that nostalgia, we can also find power. We can also find our narrative. We can find our story in order to decide what we want the next steps to look like. Of course, I know I can answer this in a very concrete way, but I think what's most important is we decide why agency is so important to us and what we want to do with it. There's no right or wrong. I think that's something that I think we've all learned in the last couple of years. There's no right way to go about a pandemic and to recover from one.
Yeah, it sounds like just it's important to kind of really kind of be open to tap into their kind of experience and explore it with them and help them and support them, I guess, in figuring out like how they want to direct that agency and how they think about that. And just one last thing I wanted to ask, if that's okay. I mean, we're talking a lot about like tapping into clients' experiences and their own identities and how they've been affected. But I was wondering if you'd feel comfortable sharing whether the pandemic has altered the way that you view your own kind of identities and how it's kind of affected your perspective, if it has.
Of course it has, yeah. Such a big question. I think I can say certainly I have been humbled as a clinician, just with people wanting to continue doing this work and being reminded of how important it is. We've certainly been, as clinicians, I think we've been reminded of the role we play and that people want us to play in their lives, to be a witness to those experiences. And so it's certainly, it's been rejuvenating, I think, in doing that work. It's made me feel, I think, more confident as a therapist that I do have something to offer, and that has been something I think we all kind of tap into once in a while. It's like, are we making a difference? Are we helping? So I've certainly felt like, yes, like I am, even if it's small, even if it's just once a week with somebody, it does feel like this is meaningful and this is significant. I've also felt way more comfortable being just, I keep using the word authentic. And, I often say that with patients too, is I would rather be real with them than pretend that I know what's going to happen or where we're going. Like, let's really join in on the unknown together. Very unlike other experiences where I might have had my own experience, or I can kind of see how this might play out. I don't know how this is going to play out. And there's no pretending that I would. So we really do get to return to what we ask patients to do, is sit in the unknown, sit in the uncertainty, remind themselves of their own resources, their own sense of self, their own strengths and growing opportunities. So it's just a great chance to tap into exactly what I would say brought us to this field.
That's wonderful.
Yeah, it sounds like a really powerful perspective. Thank you for sharing those.
Yeah.
But yeah, thank you so much for your time and for sharing your insight and input into all of our questions. And that concludes the end of the session.
All right. Thank you for having me.
So much.
Thanks.